Thank you very much for joining me this evening for another session on calorie management. Remember that we started the discussion on calorie management last week, and if you were not able to watch it, I will really encourage you to watch it. This should be available. You can contact our production team, and we'll be able to bring this information to you. Today, specifically in terms of calorie management, we'll be laying emphasis on something that I personally have practiced and I found it to be extremely helpful. I believe that the significant changes that I've seen in my health, a significant part of it, apart from God's grace, came from this practice of what we call intermittent fasting. I just want you to just look at most religions in the world actually practice intermittent fasting, and that is pretty interesting. It helps in many ways. I engage in that through my church and other activities, and I believe that not only has it got good benefits from the religious standpoint, but it is also very good for cardiovascular and overall body health. So let us start with a few observations that we know. We realize that animals, powerful animals, sometimes, most of the time, they eat once a day. And they sleep a lot. It is known that lions can sleep all the way up to 16 hours a day, and they end up eating once a day, and sometimes it's not even once a day. They may not be able to get to hunt even the subsequent day, and these strong animals do not need to eat 3 times a day. But because of development, industrial development, especially in the developed world, most people in the United States, in the developed countries, they eat 3 times a day with snack. So if you add a snack, that is a lot. And we believe that this practice of eating 3 times a day with a snack is part of the problems that we have encountered in terms of diabetes, in terms of cardiovascular problems, and it is even believed that there is a benefit from intermittent fasting for the brain. It is important for us that if we want to talk about the cardiovascular health, then we cannot ignore the importance of intermittent fasting, which I say that anybody who knows me that I strongly practice intermittent fasting, that has helped me a lot. So we know that way back in 1997, it was published in New England Journal that animals that undergo 20 hours of calorie restriction, you can use the term calorie restriction for intermittent fasting, they tend to do better. They tend to do much better than animals that eat all the time. So we have data, and most of the things that I'm going to discuss with you come from a publication that came in New England Journal. The good thing is that this was probably the first review article in New England Journal, which is one of, if not the premier medical journal in this country. It is one of the premier journals in this country, and the other publications that you can go and look at, which now came to support intermittent fasting, which I have been practicing and I've been talking about probably for the last 7 years. And now we have even stronger evidence and publication that is going to help us. So to summarize, to give you an idea of what we're going to cover today, we want to look at the mechanisms of intermittent fasting. We are not there yet. But let me broadly state this, that intermittent fasting, number one, leads to what we call metabolic switch, what we're going to discuss. It's critical and important part that helps us in the management of patient. Metabolic switch, we're going to talk about that. Then in addition to the metabolic switch, there are other things that when you are engaged in intermittent fasting, it also helps you. So it brings in calories, the metabolic switch, which I'm going to talk about. Then the other benefits of intermittent fasting, because it stimulates certain things that we're going to also talk about. Then we're going to look at the various intermittent fasting regimens which you can adopt. And then we're going to ask the question, is intermittent fasting all about weight loss? Because sometimes when people are not obese or they are not overweight, they think they are healthy. But I always tell people, I've had the opportunity to do a lot of procedures in terms of heart blockages and in terms of the leg. And I can tell you this, when people who are not obese come with heart attack, sometimes in my experience, the disease seems to be even much more severe than people who are big. So there is something we call obesity paradox. So don't just think about intermittent fasting as just a weight loss program. I mean, as I said, dieting is not just fasting. No. It's a change of lifestyle. So the discussion we're going to do is not about losing weight. I want to repeat this. It is not about losing weight, but it is about healthy overall. Today, I'm even going to go beyond cardiovascular health. Overall health for you. We're going to start with this broad statement about intermittent fasting or calorie restriction, which leads to metabolic switching. So, when you do intermittent fasting, I want to state the three broad things that it does, so that we'll all understand. Number one, as I said, it leads to metabolic switch. That means that you move from a glucose base now to fatty acids to stimulate the system. That is going to be healthy for you. That mechanism leads to your ability to undergo what? Undergo stressful situations for the body. You see, when people in our body, as part of the cycle, we produce free radicals, and these free radicals and oxidants that do damage to the body. What intermittent fasting does is the ability to reduce these free radicals, produce antioxidants in your system to be able to help you. So they do not only manage your glucose, which is your sugar, which we're going to talk about it. They also help us in reducing what? The stress that comes on the body internally. I'm not talking about stress from not having money or something like that. I'm talking about stresses that go on in the body that end up in disease. And let me tell you, intermittent fasting can also reduce what? Inflammation. So these are the three broad headings that we looked at, and then we can go on. So let us start with metabolic switch. In terms of the metabolic switch, for you to be able to understand the principle of metabolic switch, we're going to show you an article. So we're going to show you a picture from the New England Journal article that discuss these things in a graphic form, so that you're going to see the graphic of what I'm talking about, and that is going to help you. So when we eat, right? When we eat, your food contains, as I said, glucose, your food contains fat, and your food contains protein. As we've discussed, the two main sources of energy for your body is, first of all, glucose. And then if there's no glucose, it moves to the fat. So this is what we know. We're talking about the metabolic switch, which occurs in people who do intermittent fasting. So if you see over here, when somebody eats, when you eat, you have the glucose, and the glucose is what the body will use. That is carbohydrates. The body will use the carbohydrates, and the fat that is in your food is converted into triglycerides. That is the adipose tissue in your body. The fat, that means what people say fat in the body. That's what the fat end up going to. But when you start to fast, generally around 8 hours of fasting. And that is why 4 hours of fasting, 3 hours of fasting may not get it done, right? Around 8 to 12 hours of fasting, then the process, the benefits, or the process starts before you even get the benefits. So if you are looking at the diagram that is on the screen, the diagram about mechanism, which we are going to show you. So if you look down, you see something like banana slice down there. Over there, you see what we call TG. So when you start fasting, what happens is that the TG stands for triglycerides. This is written fat or adipose tissue. Everybody, adipose, you know that is fat. The fat in your body is now broken down from triglycerides into fatty acids. So the FFA stands for the fatty acids. And these fatty acids are then transferred. The fatty acids are then transferred into, you see the FFA, they are then transferred to the liver. And in the liver will then break the fatty acids down into what we call the ketone bodies. So the ketone bodies is what you see, the beta HB, and the acetyl-CoA. These are then transferred into the bloodstream, and they provide energy during the period of fasting to the brain and to the heart and to the muscle. So that is why you see that the periods of fasting is the time that it can help people reduce your weight. But I want to emphasize this, that it is not just about weight loss, but part of the mechanism of reducing your adipose tissue comes from this, is the conversion of the triglycerides to the fatty acids that goes into what? Into the liver to produce the ketone bodies, which are then sent to the brain. And these ketone bodies, whilst they are in the blood vessel, once they get to the cells in the brain and inward in the in the heart or even in the muscle, they end up improving many mechanisms in terms of removal of damaged cells of the body, and they also even enhance the repair of your body cells that can be repaired. So it improves your mechanism. The other thing that we now know beyond calorie switching that this diagram shows. So I've talked about. I'm not talking about calorie switching, metabolic switch. That is that instead of just going through the glucose, now you are going through the fatty acids and the ketone pattern. That can lead to weight loss, but it goes beyond that. Listen, you also see that once you have these ketones in your body, before I even go on, let me talk about something that is important. I just want to go back here a little bit. When you start fasting, I'm repeating this intentionally, it takes around 8 to 12 hours for your ketones to start rising in your body, and it peaks around 24 hours, and it can further increase when you continue your fasting for 48 hours. So if you want to see the true benefits of intermittent fasting, then the fasting period should generally be around a minimum of 8 hours, ideally 12 hours, and optimally 24 hours. This is what gives you the benefit of intermittent fasting. We are not talking about long-term fasting for a week. No. We're talking about restricting your calorie intake around, if you are not diabetic or something like that, if you're healthy enough to do these things, then restricting your calorie intake for about 8 to 12 hours and ideally for 24 hours. So we'll come to the various regimen. Now, the other thing that also happens, if you look at this diagram, is that once the liver produces these ketones, that is, the ketones are the beta HB and the acetyl-CoA. These ones also produce something that we will call fibroblast growth factor. You see it in this diagram. In the diagram, it is seen as FGF21. That is fibroblast growth factor 21. And this has profound beneficial effects on virtually many parts of our body, including the brain. So you see that the FGF21 goes to the muscle, goes to the heart, goes to the brain, and we'll talk about these specific benefits in all these areas, which shows you that intermittent fasting is not an issue about weight loss, but it is actually reducing your inflammation, improving your body's ability to remove free radicals and oxidants that damage your body, your cells, improves the DNA repair, which does not occur when you eat 3 meals together with snacks.
This episode is sponsored by Zenith Christ Family Chapel. ZCFC is a scripture-based church located in Spencerville, Maryland. Join us every Sunday in person or live on YouTube at 2:30 p.m. Eastern Standard Time. God bless you.
So this is a principle that has now been established, that intermittent fasting produces metabolic switching, that is moving away, that enhances the production of the ketones, and the ketones further stimulate pathways that reduces inflammation once again, improves your ability to withstand stress, and also help you in terms of your weight. So these are the points that was established. So let us look at various studies that have been done to be able to help us understand these patterns. We're going to come to the various intermittent fasting regimens that I've talked about. I want to lay emphasis on, I've talked about stress. There are a lot of stress in the system. So even for normal weight people, even if you have a normal weight, the practice of intermittent fasting is something that you should adopt. It's not just about your weight. It helps your body to be what? To be better. And I'm going to give you examples around the world for you to know that it is believed that a particular society in the world that lives longer than any other group of people in the world, their lifestyle is based on intermittent fasting and the things that we've been talking about. So if you're interested in longevity, which God gives to you, I believe that God gives everybody the opportunity to live as long as possible, but we have the right and the privilege to move it one way or the other through our own choices. So let us look at some of the trials that have been done, from animal studies. There's a study that was done by a guy by name Goodrick. And in the study of Goodrick, he showed that animals that are placed, so listen to this, it's a very, very important. So animals that are placed on he looked at rats, right, in this animal study, and he realized that he put these animals on alternate days of eating. That is what alternate intermittent fasting. And when he did that, the lifespan of the animals that were on intermittent fasting improved by 80%. This is pretty profound. So these animal studies has given us gave the impetus for clinical studies in humans to consolidate the principle that intermittent fasting is not just about weight loss, but intermittent fasting is a powerful lifestyle that we should all adapt to be able to help us. You see, so they also did another trial, just to give you a perspective here, where they did a meta-analysis of all the trials that have been done from 1934. Listen to this. 1934 to 2012. And when they looked at all the trials, the totality of the study showed that if you practice intermittent fasting, you can improve your lifespan by 14 to 45%. This is how powerful intermittent fasting is. I must say that not all the trials ended up coming up with the same results, and that is why it was important for us to do the meta-analysis. The principle of meta-analysis is you bring all the trials together and then you find the total direction that if you put all of them together, what does it say? And it is believed that the differences in the various trials come from the way that they did the intermittent fasting and the kind of food that they put them on. But overall, the totality of the study clearly demonstrate that intermittent fasting is a very very powerful thing. Before I come there, I just want us to look at some human studies for it to give you some perspective here. You see, they looked at some in one study they looked at 16 healthy, I'm using the word healthy people, and they put them on intermittent fasting, that is alternate day fasting for 22 days. And listen, they lost only 2.5% of their weight and 4% of their fat mass. Yet they had a 57% reduction in their fasting insulin levels. Very powerful. So it is not just a concept of weight loss. No. So even if you are practicing intermittent fasting and you are not seeing benefits in terms of what? In terms of your weight, you can still have benefits in controlling diabetes, in controlling what? Blood sugars. As this study showed. I mean, the number of people in the study is not big, but it reinforced the concept again. There was another study that they looked at 100 women, right? These 100 women who were they put them on the 5-2 regimen of intermittent fasting, or 25% reduction in their calorie intake. And when they looked at these women, though there was no significant reduction in weight loss, listen, no significant reduction in weight loss, yet something happened that is very important. Those women who were in the group, intermittent fasting, they had better insulin sensitivity and reduction in their weight, in their waist circumference, which we know that reduction in waist circumference is a very, very good thing for us to do. Intermittent fasting is something that if you are overweight, if you are obese, or even if you have normal weight, you should be able to adapt. Because if your health, if after discussion with your doctor, there is nothing that stands in the way of intermittent fasting. Everything that we're telling you here is advisory. So it is important that you go back to your doctor and be able to do that. So what are the benefits? We know what the benefits of intermittent fasting is. As I said, it improves the ketones, improve your resistance. And if you do intermittent fasting for a long time, then you have a sustained improvement in your ability to handle your blood sugars, in your how your body manages even the fat that you eat, even the bowel, your GI, the gastrointestinal system, the microorganisms over there is even better. It reduces the fat in your abdomen. It reduces inflammation, and it has many benefits on the heart. We'll come to that. So these things I've told you. So I'm going to come to the specifics pertaining to the heart and the brain, so that it's going to help all of us. So let us look at what does intermittent fasting do for you in terms of the heart. First of all, we now know that if you do intermittent fasting, it can lead to reduction in your heart rate. A reduction in your heart rate is a good thing. That is what we see in athletes, right? It's a sign of if it is not due to a mechanism in the conductivity or in the conduction system in your heart. A reduced heart rate, which we see in athletes, is a very good thing. So most athletes do not have a high heart rate. More athletes actually have a low heart rate. It is known that some of the best footballers the world has ever seen, their heart rates were in the 40s. So they can double and probably triple their heart rate whilst you are running with them, and they will not feel the impact that you may be feeling. So that is a good thing. It is also being shown to reduce blood pressure. That is what intermittent fasting has been shown to do. Another very important thing, as you saw in the slides that we showed you, right? What does it do? The hydrolysis of the triglycerides, the fat in your body. So it improves your cholesterol profile. if you do intermittent fasting, because as you've seen, how does your body get the ketones? The production of the ketones come from what? Come from the hydrolysis of the triglycerides. It also improves what? It also improves the management. It is known that the practice of intermittent fasting can move you from what? From pre-diabetic to what? No diabetes. And even in people with type 2 diabetes, after having a discussion with your doctor, it can significantly help you in terms of your diabetes. So this is something that you may consider bringing it up with your doctor, with your diabetic doctor, or with your primary doctor, care doctor, in consultation with your nutritionist about the practice of intermittent fasting, because of this impact, the beneficial impact on your blood pressure, on your cholesterol, on your heart rate, which are very, very important. There is a particular trial, they call it the Caloric trial. In the Caloric trial, they ask people to practice intermittent calorie restriction for a period of 2 years, right? And it showed that there was a significant benefit in people who were not obese. So this discussion of intermittent fasting, and it's not for people who are obese. I'm not talking about weight reduction here. I'm talking about a powerful lifestyle mechanism that can help you to probably live longer and and also live healthy. We are interested in long, satisfying life rather than long, difficult life, and that is what intermittent fasting can do for you. So there are many studies that have shown that. But let me tell you something about the effect of intermittent fasting. When people were asked to do intermittent fasting for just 2 to 4 weeks, alternate day, it took several weeks for the benefits of intermittent fasting to go away. So every day that you practice, every month that you practice intermittent fasting, you are ensuring long-term benefits down the road for yourself. It is believed that intermittent fasting, especially in the midlife, right? Practicing that have been shown to have benefits long-term. So some of the things that you can do whilst you are strong and healthy now can go a long way to be able to what? To help you. Now let me talk about the big one. The big one here. Could you believe that even in people with cancer, including brain tumors like glioblastoma, it is known that caloric restriction, that is intermittent fasting, is able to probably slow down the growth of these brain tumors. It does not surprise me, because these very powerful factors like the fibroblast 21 comes out of intermittent fasting, and they go to the brain and the muscle and the heart. So now there are actually trials that are looking at intermittent fasting. If a patient with a cancer can adhere to the regimen in other forms of cancers, to see the benefits of intermittent fasting. Then let's look at people with asthma, multiple sclerosis, and arthritis.
This episode is sponsored by Advanced Cardiovascular Institute. ACI treats a myriad of cardiovascular issues using patient-centered, minimally invasive procedures. Dial 301-755-6500 or scan the QR code to schedule your appointment today.
We know that weight loss reduces asthma symptoms in patients. That is found in the New England Journal paper, who are obese. But we know that. But it goes beyond that. We know that people with multiple sclerosis, the presence of practicing intermittent fasting, that is alternate days, that is a specific one. There are various forms of intermittent fasting out there that I'm going to tell you my personal one. I'm going to give you that for other people. That even people with multiple sclerosis, there's some evidence to show that the practice of intermittent fasting, that is alternate day practice, can reduce autoimmune reactions, that is your body destroying itself, and probably can help in recovery. So you are beginning to see that the principle of intermittent fasting is not just about fasting. We've seen cardiovascular benefits. We've seen benefits even in cancer. We've seen benefits in autoimmune disease. So if you are just thinking about intermittent fasting from that perspective, my hope is that at the end of the day, this particular discussion is going to change your concept for you to be able to to adapt this lifestyle. I have adapted it, and I believe that after review of this paper, I may need to even modify, because my general intermittent fasting is around. I do weekly intermittent fasting and I do monthly intermittent fasting. But because of my church and other things, I'm also a pastor, so we do a lot of fasting, monthly fasting for some time. But I'm going to go through the various regimens out there that should be able to help you. So let us look at the various form of intermittent fasting that is there. We're going to put it up for you, and it's going to be able to help you. If you see the diagram up there, what we've done with you today through this program, which I strongly encourage you, you should send this particular thing to anybody that you know about the principle of intermittent fasting that is going to help you. So the first thing that we are trying to do here is education, right? The food is so abundant in this country, but let me tell you, there is no data behind 3 square meals. I don't know where it came from. But the principle of intermittent fasting clearly shows that eating 3 times a day doesn't come with any benefits. Adapting intermittent fasting is something that I'll strongly encourage that you will have a discussion with your doctor, with your dietitian, to be able to help you. So the first thing that we have done on our part is what? Is to educate you, to let you know the benefits of intermittent fasting. Across board, from the brain to the heart to the muscle, it goes a long way to help these things. Having had this, I will strongly encourage that for us, for doctors that are watching this program, for residents and fellows and everybody, all of us that are involved in managing our patients, I believe that this is a call to action that we should on our own try to practice intermittent fasting, see the benefits thereof, which I've seen in my own life, and then be able to share experiences and help our patients to be able to do that. So you see the kind of doctors that you can talk to be able to help you. Your doctors, your dietitians. So you can have this discussion with your primary care doctor, family doctor, internal medicine doctor. Definitely a cardiologist. I am a cardiologist. I am an interventional cardiologist and a neurovascular doctor. So and that is why I'm coming to you with a principle of intermittent fasting. This is not a weight loss program. I don't do weight loss program. I do healthy cardiovascular education because I believe that I've seen that it is not just, I believe and I've seen and I've experienced that the principle of intermittent fasting is not just the concept of what? Fasting and not eating and then losing weight, because it goes beyond that. So, you see the lifestyle changes that you're talking about. Once you see your doctor, then you practice these principles. There are other things, exercise programs and those things. But the main emphasis that I want to lay here is the type of intermittent fasting that you can do. So there are 3 types that, they talk about, which is number 1 is alternate day fasting. You fast, you restrict yourself in eating for one day, then you eat the other day. So, as we said, restricting your calorie intake by 4 hours or 6 hours may probably not give you that much of a benefit. The fact that you did not eat in the morning and you ate in the evening, if you have an 8-hour difference, that is where your ketones begin to rise. If you have a 12-hour difference, that is where it's probably, we know that by that time, your ketone levels are going to rise. So, to practice intermittent fasting, you can adapt the alternate day where you do calorie restriction if you're healthy enough, and after discussing this with your primary doctor, I'm laying emphasis about this, after discussing this with your primary doctor or the cardiologist or all the people that you see over here, then you can consider the option of intermittent day fasting. Trying intermittent day fasting, if you've never fasted before, I tell you, it's going to be a challenge. Why? Because when you start fasting, when you start intermittent fasting, it can lead to a little bit of irritability, hunger and irritability that starts within the first few weeks. Generally, it is known that these side effects of intermittent fasting will go away after 1 month, and you are not going to experience that any longer. So I will strongly urge you that after discussion with your doctor and other things, if you're having these things, you should not be too worried. These are normal things that you see. So the ones that have been tested is alternate day. You fast for 1 day, then you eat 1 day. You fast for 1 day, then you eat 1 day. So that is what is out there, and that's what people practice. That may be difficult to start. I mean, for me, it's pretty easy for me to be able to do that because I've practiced this for probably 6-7 years now. So that is something that you do, and you can mix them. To be honest with you, you can mix them. So let me go to the other thing. We'll call it the 5 and 2. So if you look at this New England Journal paper that you are looking at it now, I think this is it's an adaptation of the second one and the third one. So the 5 and 2 principle is that you fast 2 days every week. So if we have 7 days, you make a decision to fast on Tuesday and fast on Friday, or you fast on Thursday and you fast on Monday. So if you fast 2 times in a week, that calorie restriction is also something that is very good. So you can do every other day, which is tough, or you can do the 5 in 2, which is a little easier, or you can do what we call the time restricted feeding. And I like the combination of the 5 and 2 and the time restricted approach. So if you want to, this is what is seen in the intermittent fasting. This is not for long-term fasting. This is what is seen in the practice of intermittent fasting that they put up here, which I really like. And I think it is easier for you to adapt. So what you do is the fact that you start with 1 day every week, the first month. Your total calorie intake is 1,000. Let me give you an idea what 1,000 is, right? I went to a restaurant recently and they were selling a small box of fried chips and chicken. When I put them together, the calorie intake was about 960. I went to a place I told you last week. I had a bowl of spaghetti, but the calorie intake for that one is what? For that one was 1,300. So you can start the first month where you have what? A 10-hour feeding period, 5 days a week. So we're going to do these two. So look at it carefully. So you eat only within an interval of 10 hours, 5 days a week. That's it. Then you move to the next month where you only eat for 8-hour period, 5 days a week. Let me explain the principle of how these things work. It means that if you have a 24 hours in a day and you only feed yourself within 10 hours, that means that 14 hours of the day you should have no food, 5 days a week. That is the principle. When you come to so you do that for 1 month. Then you come to the second month. In the second month, you do 8-hour feeding period, which is 5 what? That means that 16 hours of the day. So if you sleep for 8 hours in a day, then during the day, you have only an 8-hour period where you should eat. And generally, that will mean that you are going to end up eating 1 meal plus something. That is what you want to do. So I'm dealing with the time restricted feeding. Then we have the 6 hours. 6 hours feeding period 5 times a day. This is what it translates into. So if you sleep for 8 hours, you are left with 16 hours. And if you get up in the morning and you end up eating your breakfast, Then either you ate your breakfast at 8 o'clock or 7 o'clock. You have the opportunity to only eat again up to from 7 all the way to 12 is 5 hours, up to 3 o'clock. Beyond that, you should not eat. That is your feeding period. If you have the 6-hour one, if you ate at 7 o'clock, up to 1 o'clock, that is when you can take any meal. Beyond that, you don't. Then finally, your goal is to end up that every day you end up eating during a 6-hour period of the day. And that is what you take. Okay, so you can decide that, okay, I'm going to eat from 7 o'clock, or I'm going to eat from 7 o'clock or 8 o'clock up to 2 o'clock. Beyond that, I don't eat. You will be surprised that people practice this and it's been very effective. I heard a story of a guy who was a cook. He had 3 heart attacks whilst he was a cook. And he heard somebody talk about intermittent fasting. He stopped being a cook and he decided that he's going to be a tourist, mountain climbing guide. And he started the principle of intermittent fasting, and he ended up eating one day. And I'm sure he has the time restricted approach. That is what he's using. Time restricted feeding. That if I eat within the days, I'm going to eat within this certain period. Once I eat within that period, I'm not going to eat for the rest of the day. And since he started doing that, he's not had a heart attack. I heard this story and it really, 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 really reinforced the idea of intermittent fasting. Now let us do the 5 to 2. The 5 to 2 I said is probably the easiest to do. So the 5 to 2 intermittent fasting, what you do is that one day in a week, you restrict your calorie to 1,000. This is something that you do one day. If it's on Thursdays, you do that for 1 week. You do that every week, you do that. And then the second month, you pick 2 days that you do calorie restriction of 1,000. That may transform to probably 1 or 2 meals, but that is where you're going to be. And then during the third month, 2 days in a week, you restrict your calorie intake to what, 750. That may generally, that in practical terms, looking at the general American diet that we have in this country, that may be generally around 1 meal plus a small snack 2 times in a week. That's what you do 2 times in a week. So you pick Tuesday or Thursday or Wednesday or Friday, any day that you want. That is the days that you practice that. The other days you do. That is what you do in your third month. And then finally, this is what you do. Very easy. Very, very easy. You restrict yourselves to only 500 what? 500 calorie. That means 1 meal every 2 days, 1 meal in 2 days every week. So if you are here with me, you realize that looking at these principles, if you are healthy enough and after having a discussion with your doctor, most of us, I wouldn't say all of us, because of some health related issues, not everybody can probably do intermittent fasting. But having seen the benefits even in cancer patients and other people, I believe that after talking to your doctor, primary doctors and your specialists, virtually everybody can practice the principle of 5 to 2 intermittent fasting. That will help you. I practice. I'm currently around level 4 of the 5. I don't do the 5. I do the 5 to 2 on my normal days, and generally once or twice in a month. We also do 3 to 5 days of fasting every month, further improving my my metabolic switch. There is one part of the world. There is an island in Japan called Okinawa. It is believed that the people in Okinawa, Okinawa, the people in Okinawa have probably the greatest longevity in the world. Very important. And it is known that the people in Okinawa, it is believed that probably Japan is known to have more people that are more than 100 years old though than any other country in the world. And it is known that the people of Okinawa probably are the people that live long than probably the rest of the world. And the people in Okinawa, it is known that their lifestyle is based on intermittent fasting. And with their food that is low in calorie, based on legumes. What did I say about legumes? Legumes have what? Excellent glycemic index. You see the principles we're talking about. So we have epidemiologic evidence that if you do the right things, you can live long, as long as God gives to you. So we know that in people in Okinawa, they practice intermittent fasting. And they also what? Their diet is also based on low glycemic index food, which is vegetables and what? And legumes, right? And in addition to that, one thing that I found out today is that they also eat sweet potatoes, which seem to have some good. So probably you can also switch, you can also add that. I'm going to look into, I've not looked at the benefits of sweet potatoes, but I'm going to look at it. I mean, I like good things. So if something is good, I want to look at it. So I believe that if nothing will convince you, what is happening in Okinawa and what we've known about them should be enough evidence to you that a lifestyle of intermittent fasting, and I've shown you these things, that is there, and you can also go and read the New England Journal article yourself. A lifestyle of intermittent fasting combined with appropriate dietary patterns in which your food is based on low glycemic index food has been shown without a shadow of doubt in at least people in Okinawa to produce longevity. So that epidemiological evidence should hopefully help convince you and me to make the appropriate changes in our lifestyle. Every day of intermittent fasting is producing benefits for weeks ahead of you. I hope we've been helpful. This is Dr. Isaac Opoku-Asare. I want to thank my production team that has been doing an excellent job. God bless you. God bless this country, America. Thank you.
Thanks for listening to God's Rhythm. Tune in every Monday and Thursday at 10 a.m. Eastern Standard Time to learn how to protect your heart. God bless you.